Good morning, everyone. We'll give it a couple more minutes here to see if there's a few more that join us. Well, the open door has slowed down a little bit. I'll give it just another minute here and see if we have anybody else coming in. Well, Travis, I will hand it off to you, sir. I think our people coming into the room has slowed down.
Okay, good morning, everyone. How are we this fine Wednesday morning?
Good morning.
Good. Nice to see everyone today. Well, to get things kicked off here, why don't we just kind of touch base on what we talked about last time, which is the name of our work. We had discussed transitioning a little bit to being the Buffalo County Wellbeing Collaborative. And I think there was some general feeling last time that that name appropriately captured everything that we were taking a look at doing. Without kind of restarting from scratch again, is everyone still comfortable now that we've had a little bit of time to sit on that is kind of an appropriate namesake for us? I will take head nods and silence as compliance or agreement this morning. Thumbs up from Judy. Okay. So I just wanted to kind of solidify that will be us going forward. So welcome everyone to our official namesake with that. I think that's great. And then again, thank you all for being here. I know that we're still working through some timing with a big group like this, and with all of your busy schedules. I know that it is difficult for us, but I know Denise and the staff are working very hard to try and find a time that fits best where we can capture the most of us each month. So hopefully we'll be able to see more of us being able to participate on a routine basis. But I appreciate everyone. I'm starting to see a lot of familiar faces time after time, and really appreciate your commitment to this work, and not just being a one-timer to stop in, see what's going on, and then kind of drift off into the sunset. So that truly is very much appreciated. Lastly, for me today then is, do we have the minutes from last meeting? Do we want to pull those up? Did anyone have a chance to review those or have any questions about what we covered last time, or recommendations or changes? And Denise, as far as procedure, are you just, are we at a point where we need to officially vote or for meeting minutes? Okay, so if I can get someone to take a look through and approve, we'll do an approval, a second, and then vote on minutes. If I can get someone to do that, please.
This is Kathy Gifford. I move to accept the minutes, approve the minutes from the last collaborative meeting.
Okay, we've got approval from Kathy. Thank you.
This is Nadia. I'll second it.
Nadia for a second. And then if you could all please put in the chat if you approve, that would be appreciated. That way we can get that documented, especially since we're recording the meeting. I would appreciate that. I'm starting to see some pop in there. And if you don't approve, please also note that in there. I'll give everyone just a second to cast a vote. And it looks like we've already got a majority for this group. So I appreciate everyone for getting a chance to review those and to vote on that. And I will turn things over to Denise this morning. Thank you, everyone.
Thank you, everyone. I am going to do somewhat of a brief overview of what we have accomplished so far, which you guys have accomplished a lot. I know some of these conversations start to blend a little bit. If you've been having conversations on the board, you've been in the collaborative meetings with a large group, or you've been in these steering committee meetings, or like a planning and measurement committee meeting. Some of these conversations are starting to kind of weave themselves together, which is fantastic. So today, what I hope to accomplish is be able to answer the questions that you asked of us as staff and leaders of this work last month. And what we heard each of you say coming out of those breakouts was, where is the staff in the work of that model? And then how do we lift up the work of the coalitions in that model? So those are the two pieces we're really going to be focusing on today. And so we might get a little deep into the weeds, but I also want you to know that this is the work of the staff. So these things that we're going to be talking about today are the things that the staff has been continuing to work on throughout the entire pandemic, and making sure that this work continues even though we're not having those coalition meetings. So I would want to just give you a look at that and have a chance to kind of talk about that, so you can kind of see that from our perspective and what work we're lifting up to this group. So with that, I'm going to go back here to the agenda. Make sure I covered, okay, we finalized the collaborative name. We want to refresh our knowledge in the work that we've done today. And then I've already mentioned number 3. So we have a collective impact model that we're working very diligently to implement within the community. We have also decided the results-based accountability model is the model for us. And that model begins to ask, how much have we done? So the number of people we've impacted, how well did we do it? And then did we achieve the overall impact? So did we change behaviors or attitudes? So it's that 3-box model that we have been looking at for the last, well, some of you for the last year or more. We also have the community health and wellness indicators. So the data, and I know Judy Sickler and Travis were some of those early steering committee members who'd built that data piece. And so that now is called the community health and wellness indicators. So that's the data that came out of the data dive to say, what are we working on as a community, or what's important for us to be looking at? And so that information is available. And then through the conversations that we had with the board, and many of you who are sitting around this table right now, was able to be synthesized and develop our vision statements. And so that's the lens in which we're going to look at our work or look at the data. So those vision statements have also been completed. And within that, we've also drafted some of those community gaps that have been brought forward with those individuals who've already met with the board. So we've done really, really great work so far. And then you finalized this model. So let me get to this in your packet. You finalized this model at the last meeting. You had a great conversation about you being here in that steering committee box. We also talked about community partners being that backbone and fiscal agent at the bottom to hold and lift up this work. And then that overall collaborative with the 4 work groups. And we started to talk a little bit about what is our role within this work. And so we used a lot of language like convener, advocate, recorder, things like that, to really begin to define what our roles are in this steering committee that we bring forward into this wellness collaborative. And then we wanted to start talking about, are those circles of those work groups the right circles to be focused on? And at that point is when you begin to ask questions, where is the staff, or how does the staff align to this? And where do the coalitions align to those 4 work groups? So we want to be able to answer that question today. So any questions right now about where we've been and where we're starting our conversations today? All right, hearing none, as a staff, we sat down and said, where are our areas of expertise? And you see here listed our collaborative staff, coalition and collaborative staff. So where you see staff, those are staff assignments to those work groups based on their experience and the work that they've done to date. So in the area of behavioral health, we put Tana Miller and Wanda Fedorchak and Oriana. And then in the vulnerable populations, we put Martha, Josh Arias, and Jackie. And then in the area of access, again, we put Martha, and I added myself in there to help support Martha and Jackie. And then on the staff for children and adolescents, we put down Wanda, Josh, and Oriana. So that's how we've been beginning to break out our staff. You'll notice that not all of our staff are listed here. So myself, Matt, Michelle Toucan, and our bookkeeper would be our operations staff. So they're going to be more of the staff that's working out of the backbone to lift up the data. They're going to be lifting up the promotional pieces, the overall management of the organization. And the staff that you see here will be the collaborative staffing support to these work groups. So questions that you have as you think about the staff assignments as we laid them out so far.
The question about children and adolescents, does all of our preschool stuff that Tana's been doing fall under that, or does it fall under behavioral health?
We've talked about that. There's some of those things that just are connected. And I think I see I made an error, didn't I? Because Tana should be in there. What did I do? Tana was in there, wasn't she, Wanda? Oh my gosh, Denise, what have you done?
I think we talked about her being a part of that, and I don't know that we landed on officially plugging her in, but we did talk about her work fitting there. I don't know that, yeah, we finalized where that would end up.
Yes, thank you for refreshing my memory. Even though she's not listed as that staff support, it doesn't mean that she isn't bringing experience on early childhood development into that circle. So yes, we saw early childhood development in that children and adolescents. But you'll see a lot of crossover into behavioral health, which I think you're going to see that throughout the day. I think that really help us understand if we've got the right focus on these work groups today.
For us non-medical people, what's the difference between mental health and behavioral health?
Behavioral health would include substance abuse and mental health. So both pieces of that. Great question, Judy. And focus is probably mainly on behaviors. So there could be a lot of pieces that fit into that. And that's where Dr. Schaefer was kind of asking, like, our behavior work that we do in early childhood, where does it best fit? Other questions?
Was there anything that we've discussed in the last couple of years that doesn't fit nice and tidy in these boxes?
I'm sorry, I can't hear you, Judy.
I was just asking if, we've been in lots of meetings the last 2 years. Does anything that we discussed that we want to continue on with not fit in these 4 boxes?
I don't believe so, because we've been working from that matrix that the original steering committee prior to the pandemic created based on data.
Thank you.
But that doesn't mean that new emerging pieces could not appear that maybe don't fit as easily into that. But I think that would be a question of the steering committee. What do we do when something like that does pop up? Do we address it, or how do we determine if we address it, or where does it fit? Yeah, and Kathy's saying that as well, but there's a lot of crossover. So I think that
Oh, I was
Go
just
ahead.
gonna say, could I make a suggestion? So I know that we all come from different backgrounds here. And just kind of bringing up what Judy just asked about what is behavioral health. We all have our different areas and our specialties. I was wondering if we could potentially create maybe kind of like our definitions for what is behavioral health. So we all have that common language. And like I said, we all have our own specialties. It could mean something different in our specialized area versus somebody else's.
Very good suggestion, Cheyenne. And that was one of the pieces we as a staff talked about creating for you today, in even a broader context than just these work groups, but also in the context of what is our definition of a steering committee? What is the definition for the work of planning and measurement? Just trying to firm up some of those pieces. So I think that's work that will continue to evolve as we have these conversations, but great observation, Cheyenne. I also would say some of this work too will help us when we come back to the full collaborative to introduce this is our thinking and have them bounce off that and poke at that a little bit and let us know if they agree or if they have other things to add. Anything else from the group? Great observations and questions.
Denise, I've looked at this many times and it's just hitting on me now, but just visually the way that it represents, maybe there's an opportunity to have, so behavioral health and children and adolescents, those two circles don't intersect. And then vulnerable populations and access, those two circles don't intersect. So if we could just maybe condense the graphic to kind of what Dr. Schaefer was saying and others are mentioning, is because all areas, and you mentioned all areas overlap into other areas. So maybe visually we could represent that here. And I know it's a small thing, man. I should have caught this, 2 months ago, taking a look at this, and I apologize for that.
Great observation. I think we can do that. Michelle's been fantastic at creating this graphic. So
Michelle just put a note in. She says they were supposed to intersect, but when you zoom in, it doesn't do it.
Oh, thank you, Michelle. I made it too big for all of us today. All right, other observations before we go into the next element of our conversation today? I also believe a lot of this work come out of the collaborative as well. When they met, they wanted to see who are all the groups that are a part of the collaborative. So we listed all of those sectors that should and could be involved in this work. All right, I'm going to go back to the agenda to help myself stay on track here. So we are we're here at this piece, right? Where are we in the model? Where are you in the model? And so for the sake of today, you're serving as steering committee members, but I also know that I've had several of you mention that I'm also have a foot in these other circles, and just being cognizant of how that interaction occurs and how you kind of see that interaction will be important in this next conversation. So the next conversation, oh my gosh, 8:50, nail it on the head. Check that out. I don't know that that's ever happened, but we'll go with that today. So the question you posed last month, how do staff and the coalitions plug in? The one thing we would like to invite all of you to consider is that we let those walls of the coalitions down for the sake of the conversation we're having today. That doesn't mean that there's not still coalitions that can continue to do this work. It's just in order for us to really take a good look at this, we're asking that we just kind of set those walls of the coalition down for a minute and open our thoughts to what the work of the coalitions are. And that is what we see as prevention strategies. So I sent out a 6-page document. I didn't expect all of you to read it all the way through till midnight last night, but it is in your packet and we'll kind of get to that today. But for the sake of the conversation today, we just wanted to ask if we could kind of set those walls and those dividers down for a minute just to have this conversation. So we've talked a little bit about how the staff see their work, and a piece that we wanted to share today is a piece that we shared with the board last week. So I'm going to get to that document. So stick with me here. So here is the document that we wanted to talk through a little bit today, but I also think this would be a great document for you to look through on your own time as well, to just kind of get your mind wrapped around how this work has began to evolve at Community Partners. So as we began to ask ourselves as staff, how did we do our work before the pandemic? And then how would we like to see our work evolve and continue to evolve? We truly could see that a lot of our work prior to the pandemic and in the last 10 years of our work, that we were very outcome focused. We were really good, well-trained, great education on building logic models, building goals, achievable action steps, finding funding for those logic models. And we were very outcome focused and very successful in that work. So that was what we saw, how we did our work before. Today, what we see is because of that very focused, tremendous work that we did and successes that we've seen, we now are ready to start asking these impact-focused pieces. So is anybody better off now that the work that we've done? We've been able to count numbers of people we've impacted. We've been able to say, how well did we do it? But now we're really beginning to ask more questions about, is anybody better off because we offered SNAP double up food bucks at the Kearney Food Market, Kearney Farmers Market, there we go. Or are those people that we gave a million food boxes to now sustained and have food security? So those are the impact questions we're beginning to ask. And the staff really would like to see that work continue because they're really enjoying noticing how important that work is and how that impact it has been achieved. So I'm going to just call on a few staff to share a little bit. And since I don't have my list of or see everybody's faces, I'm going to blindly call out and hope they're here on the call. So let's start with Josh. Josh, do you want to talk a little bit about how you have seen your work before and how you've seen your work evolve?
Yeah, so before, I think in terms of like Photo Voice, it was very kind of grant focused. We kind of had to meet a certain amount of kids that we wanted to impact, and we worked on trying to get them through the program, get a little event scheduled and stuff, and then we kind of sent them on our way. So we've been trying to evolve that to continue to engage them in our work, engage them in our youth board, and keep their voice kind of in all of our work. So, and in terms of YAB, I feel like before it was like we tried to do projects kind of on our own. We were out there doing cool stuff, and then it didn't really fit everything that we were doing as the overall here at our office. So what we've been trying to do now is really engage them in the work and have their voice, across all of our work that we're doing. And that started, I think, in the pandemic time. We would do like focus groups with the youth, and they've really liked that. So we've been trying to change it. So we're not just trying to do like just one event for the year. We're working throughout the whole year with our staff and with our whole team. So. And I guess, I can talk a little bit. You guys are highlighting there. So I've scheduled with Mr. Owens 2 Photo Voice classes with a potential third at the Hani Aram Center, which is another thing that we've been working towards, is how to reach those youth kind of where they're at. So, it would be a class that would be done during the day there, and we have a good group of kids engaged. We have about 25 there that are ready and willing to be part of the program. So I think before they would kind of come to our office, but I think this would be cool to get this off the ground. We've also done Photo Voice classes completely in Spanish. So we've been trying to get that voice heard and just kind of see what their issues are, what their kind of things are that they're trying to work on. So trying to think if there's any other things bright and early this morning, but yes, our work has changed a lot.
Great share, Josh. Thank you. Let's go with Martha next.
Good morning, everyone. One of the outcomes of our work that we used to do was that our gaps and our needs, they used to be built in the logic models, and they might not have been discussed again or not been discussed regularly. But how that's changed now is that we have been advocating a lot in our meetings for the needs and the gaps in our community. I think of like the health disparities that exist between Hispanics and Latinos. There are preventable differences that impact their health outcome, things that don't allow them to achieve optimal health. And so being able to go to those meetings and advocate what we've been hearing in our community, that are needs, that are gaps in our community that make it hard for them to access resources. Those are some of the things of how it's changed from the logic models and staying in the logic models to then really lifting some of those concerns and some of those gaps in our community that we're seeing. The other piece too was we would do a lot of the grant writing for a lot of the different groups that we were in, but now we've been able to share some of those links, some of those grant opportunities, and provide those to our stakeholders. And they've been able to, with our help, successfully submit some of those grants, be awarded some of those grants. And so that's been something that has changed from how we previously used to do the grant writing and then implementing the program and designing it, doing the walks, all of those program pieces of designing it and implementing it, to then just being able to provide some of those opportunities for our partners to be able to lead.
And Wanda, would you like to share?
Yeah, so in the work of the coalition, traditionally, like the rest of you guys have said, our logic model would hold our strategies and our tasks and all of those pieces. While those are still completely relevant and important to continue on, we're just looking at how we can do that better. And then instead of just focusing on, how many people did we have attend this event, what was the actual impact? So for instance, when we were working throughout the pandemic and identified unconnected youth as an issue, they were struggling. We were able to form a small work group that came together and worked on strategies to address that. We put together a presentation to put out information to the community. It was a great presentation. We had a nice turnout, but then we got to thinking about, instead of just continuing to do this, how can we do this better? How can we get a greater impact? Because we felt like the people that came were maybe not necessarily the ones that needed to hear that information. So just continuing to think about ways to get the best impact from those types of projects, and just taking a more community collaborative approach and coming up with those strategies. So yeah, it's been exciting to think about doing it a little differently to get a better impact.
And I believe Wanda's area, she's been working with Positive Pressure, which is a group that has been operating. And I think, Doug, you're on this group too. That group originally started in the mid-90s. So their focus has been very strong in evidence-based programs that have been very successful, like Prescription Take Back and Be Safe, Be Smart. During cruise night, tips training for responsible beverage service. So you can see the very important elements of that logic model and that focus, and a lot of collective impact was in those early stages. But I think they're ready to start asking those questions. Now what, right? Is our community better off? Have we been able to reduce youth alcohol use, or what else can we be doing that maybe takes into account working further upstream to prevent youth use of alcohol and substances? So great work, Wanda, and thank you for sharing. And I don't know, Nadia, do you want to take a stab at kind of Tana's piece that she spoke about? And I'm just going to open it up by saying just kind of that suicide prevention piece that we've seen kind of a shift. I think focusing here kind of on what we're seeing with this very specific work around walks and what that potential could be. Would you be comfortable sharing that?
I can try.
I'm really putting you on the
I
spot.
can't
I'm sorry.
remember, well, I can't remember what it translated into, but there was a lot of time spent by staff in coordinating walks for different organizations, and a lot of it was very, very similar work and a very similar plan across those organizations, but it fell back on staff to try and coordinate those activities and find speakers to come to those walks. Again, just really with focus on that, counting how many people attend and how many people take items or packets or things from the event, but not really being able to answer the question, is this really having an impact? So long term, are these resources utilized? And so really focusing more on earlier prevention work in order to have more of an impact. That's sort of what she said.
Yes, Tana is actually at the state capitol today, working with many other childcare, early childcare advocates, and they're doing a Nebraska Policy Academy. So she's been doing some great work in the area of policy and early childhood. So she is out today and unable to assist us, but we're excited to hear about her work in that space too. So questions you might have now. Hopefully we've given a little bit more color to this work of how we used to do our work and how we are beginning to see it evolve. And just kind of open it up for questions or thoughts, maybe that's provoked. And some of you have heard this before, so maybe there's more thoughts that are bubbling up.
So my question is merging our funding sources with the new impact model. And obviously our funding sources would probably like to have the impact knowledge of what we're impacting, but that's still a concern, is that we meet those funding sources needs. That
Yes,
may
Dr.
be a little
Schaefer.
different than what our community needs are sometimes.
So a couple of funders that we have really tried to focus on communicating with, Tana and I sat down with Beth Baxter and Tiffany Gressley early on in this process with Region 3 and said, this is where we're headed. They pretty much blessed the work and said, yes, we totally believe in where you're going, and gave us that authority to say, yeah, continue doing the great work you're doing, but knowing that we still need to attend to the work that we're being funded to do, right? We still need to do prescription take back. We still need to do medication access boxes in the community. We still need to be focused on what are those substance abuse prevention, evidence-based programs that are important in the community. So we've been trying to keep both of those pieces lifted up in the community, and keep that line of communication open with Region 3. And we've been doing the same with CHI Health with their community benefit funding. They too are in a process of setting their new priorities for 3 years. And so I just spoke with Sarah Sanslav a couple of weeks ago, and our priorities line up almost perfectly. So that again tells you that we're on the right track as a community. If another organization is doing an assessment and those still align, we're traveling in the right direction. So yeah, we have been talking with some of those funders, but yes, that is something to always keep in mind. This next piece we're going into, you're going to actually see where that funding is. You're going to be able to see some of that alignment as well. Other observations or thoughts, questions? And I guess I should say Nebraska Children and Family, of course, are giving us this funding to do this work. So they're very supportive of that. And I believe the Zoom user on this call is Joanna. She's listening in, but she's traveling today. Thank you for the shout out, Judy. We hope we're working smarter, not harder. That's been kind of our motto through all of this. Other thoughts people want to share? Okay, we are going to go back to our agenda. And since I am somewhat technology challenged to see 10 screens at once, you'll have to be patient with me for just a second. So I think the next question begins with your decisions. Where do you begin to see your work align within these work groups? So if you've given some consideration about where your expertise lies, which one of these circles best represent the work that you bring to the community. We are going to start breaking out into breakout groups. And I know we have a very small group, but I still think we'll have some great conversation. We're going to ensure that we have staff, those lead staff people in each of those breakouts. I'm going to go ahead and go try to do 4, but we may only have just 2 or 3 people in each of those breakouts. But I do think this will be good conversation for us. And then we'll come back and report out. So be thinking about which one of those circles best fits where you want to be at this time for this next conversation. So to start to introduce this next conversation, I am going to go back to the prevention strategies to lift up into the work groups. So I mentioned that the coalitions all are working on prevention strategies. They're embedded in those logic models. So they're in some cases sustained, and actually some are operating without even additional funding because of the work that we've done in the past. So prevention strategies, these are pieces that the staff set back and said, okay, of all the work we're doing, let's start putting it together so that we can start showing the community what work is out there that we have been intending to. So this is split up into sections. The first section you'll notice is providing information. And these are actually out of the strategic planning framework, which I think Cheyenne is very familiar with that. It comes out of drug-free communities and federal funding are as proven strategies to impact and for prevention. So providing information is one major strategy, and it is educational presentation, workshop, and other data presentation, public announcements, brochures, meetings, social media. The next one is building skills. Building skills are workshops and other activities designed to increase the skills of participants, members, and staff needed to achieve population outcomes. So training, technical assistance, distance learning, strategic planning retreats, developing curriculum, stuff like that. So building skills is the second one of the strategic planning framework for prevention. The next one is providing support. So creating opportunities to support people to participate in activities that reduce risk and enhance protection. So this would be things like mentoring, referrals, support groups, clubs, specific clubs, alternative activities. We attempted some of that work with Be Safe, Be Smart when we worked with Graham Tire to start promoting an additional activity during cruise night to pull some of the traffic off of 25th Street, which was a very successful alternative activity to start to slow the risky behavior during cruise night. The next one is enhancing access. So improving systems and processes to increase ease, availability, and opportunity to utilize those systems and services. So ensuring childcare, transportation, safety, special needs, cultural and language sensitivity. And so we've dropped some of our work into enhancing access. And then changing consequences. So we're wanting to increase or decrease the probability of some behavior that we're wanting to focus on. And the last two are a little bit more slim because we haven't done a lot of work in here, but physical design, this would be like access to trails, sidewalks, walk to school, bike to school. We've done some of that work in the past, but actual physical design in the community that promotes health or prevention, and then changing policy. And I put Tana's work here in this changing policy since she's down at the state capitol. So that is how we as staff have been trained to do prevention work. This is how we begin to build logic models. This is the structure, and you don't always see and hear us talking about this, but it's the behind the scenes and how we're arranging information. So I know this is a heavy lift, but what we're asking for your consideration is to, once you decide which area you want to attend to today for the conversation, and again, just for today, do you want to talk about youth and adolescents, or do you want to be in behavioral health, or do you want to be in vulnerable persons, or do you want to be in the access conversation? So when you get to that group, I'd like you to just identify over here which work group the staff has said the strategy fits under. And then the next piece that we really want to get to is what is the intended impact of that strategy? And I don't want you to take on this whole document. It'd be good if you just picked one piece, right? Because this is a heavy, heavy lift. But I think for us to begin to understand this work and be able to lift it up in the community, this could be our guiding tool. And again, this is something your staff's been trained on. This is the stuff your staff is working on and can help lift up this work. So for example, I'll just walk through maybe one example. Let's go here to the importance of social emotional development and awareness. This is funded. It's under the Providing Information. It is funded by Rooted in Relationships with Nebraska Children and Families Foundation, who supports the work that you're doing today. The overall impact that they are hoping to achieve, they being Nebraska Children and Families and the Rooted in Relationships group, is to prevent youth from entering the system and build social emotional health, and build coping skills. So that's their overall impact of what they would like to achieve. And so you see over here, the staff said, well, it probably best fits around behavioral health, that children, youth, and adolescents group. Now, also, I want to zip down to, well, let's just stay here. Sorry. Here is a piece that is parent education on Reaching Teens Toolkit, the 4 developmental assets funded by Region 3 in the area of youth and adolescence. And the youth is, and our staff has been seeing these connections. And I think the challenge is the staff right now are the only ones that are seeing this connection. So we're really, this is why we're excited about this model, because the overall impact of what this group is working on is also to prevent youth from entering the system. So I'll let that resonate for just a minute. That document is available for you to look at. Hopefully you have it up on your screen. I want us to break up into those 4 breakout groups that are named by work groups. It's a lot of groups, isn't it? So hopefully you're thinking about what group you want to be in. For the sake of the conversation today, this does not mean you have to stay in that group forever, just for the conversation today. When you get into that breakout group, I want you to begin asking the question, which prevention strategies would be lifted up in this work group to ensure the coalition work is heard and involved in the conversations. And you don't have to pick all of them, just maybe pick one to start your conversation. What prevention strategy would be lifted up in that work group? And then begin to ask yourself, what unique factor do you see related to impact? We'll have 20 minutes for those 2 questions. We'll go ahead and post them in the chat to keep you centered around those conversations, and then we'll report back out. Any questions you have? Again, we're working on answering 2 questions that you posed from last month. How are the staff involved in this work? And where do we see the coalition work in this model? We took a deep dive. You don't need to know the whole document, but we want to make sure that you are aware of the document and what it could pose to this work. Questions you have before we go into breakout?
I don't see housing on here. Am I missing it?
Housing is a piece of that community response team work. And so it hasn't been listed as a prevention strategy. So prevention strategy is probably more in the access pieces with CRT. And housing, I would say, probably falls a little bit between that vulnerable person population and the access work groups. I'm looking at just who we have on this call. Matt, can we do 2 breakouts and combine access and vulnerable persons in one group, and the other group be behavioral health and youth and children and adolescents? Yeah, Dr. Schaefer's saying thank you because he's like, I didn't know which group to go with. I'm throwing Matt off because he was prepared to do something different. Any questions you have why Matt's working his magic behind the scenes?
Did you say we were gonna work out in our groups? Who's leading the workout, and are we doing burpees? Judy's leading.
Michelle, do you have a quick exercise for all of us when we get to those groups? By the way, do not follow Michelle's workout if you are not Olympic trained, because it will kick your butt in like 10 seconds. Just going to tell you, I couldn't walk for days after 10 minutes working out with that girl.
I was sore for a week, and it was like I was sore in like muscles I didn't even know I had. That's horrible.
I hated to confess I couldn't even walk afterwards. All right, Matt, have we given you enough time? Great conversations out of our group. I'm not sure how the other group went, but really, really good conversations. So I'll go ahead and report for our group. Did the other group have somebody willing to report out on the 2 questions we asked? Or you all just fill in as you go? Well,
I think Michelle volunteered for us.
Okay, great. Well, I'll share a little bit about what I heard in our breakout group. So again, for those who were on the recording, we had 2 questions, right? How do we lift up the work of the coalitions, these prevention strategies, as we move forward into this collaborative? And then the other question was, what unique factors are we starting to see around the impact? So our group dug really quickly into early childhood pieces, and we talked about the role of parent. We talked about all the different pieces that were important in these conversations. And from my perspective, I was able to see, and again, I'm coming in as a staff perspective, I was starting to see everything that was being mentioned was being held in a conversation somewhere, or was being implemented in different pieces or parts of the existing structure that we have in community partners. So we knew we were on the right track, and that information was available and has people around that conversation. So then we started to move into that impact question. I think Dr. Schaefer started us on that path fairly quickly and said, if we are truly working to prevent youth from entering the system, it really should be youth and families as our overall impact. And then as we talked about that more, we started to say it's people, it's persons. We're really trying to prevent people from entering the system and work upstream from that. And so that was a lot of the conversation that we had. I will stop there and let Nadia, Dr. Schaefer, Emily, Cheyenne, Wanda, anything else you want to kick in from our breakout group that I missed? I think what I thought was interesting is Emily went through an entire, how do I say, a walkthrough, like a CPS walkthrough with us. And I was like, oh my gosh, that was so amazing, Emily. That's what the youth services team has been doing, is really paying attention to that piece. Kathy Gifford and Dr. Schaefer did a whole pass through how to get parents involved in preschool and early childhood, and where are the gaps in early childhood. And we're like, oh, that's perfect. That's what the early childhood collaborative is working on. So it was just really neat to see how those pieces all fit as we were having the same conversations, right? So having that bigger group have these conversations, I think will be helpful. All right, Michelle.
All right, here we go. So we talked about the access, obviously the access and vulnerable populations. First, I'll touch on the access. The prevention strategy we really looked at was enhancing access. How lovely that goes together. Judy and Travis talked a little bit about our community response team and how we're always, we're looking to get these people access to more services, right? And Judy made a great point. We need to keep asking these people, what do they really need? Maybe they need a food box right now, but do they not have a job? Do they not have childcare? So we decided that those were just great conversations to lift up in that access group. And then that also goes along with creating more impact, right? Because we don't want to ask just, did they get a food box or do you have a job? But are you able to pay your rent now? And just kind of those bigger impact questions. And then quickly with our vulnerable populations, we heard from Josh about his amazing photo voice program. And again, kind of those same conversations. These kids and youth that he work with are usually part of those vulnerable populations. And how do we not just give them a camera and give them a program, but how do we ask these kids, really hear their voice, as Josh says, about what they really need? Do they need a trusting adult? Do they have someone in their life they can talk to? Do they need behavioral health services? Do they need, what else do they need so that they can go on to be thriving young adults? So Josh, Judy, Travis, what did I miss?
You nailed it. That was good.
We talked about too, seeing if we could find some resources to help all these different nonprofits afford time or people power to do this entering in of the information. We just think it's kind of the start of the ripple effect, where if we have better data, number one, we'll understand what the needs are, as well as help connect funders potentially. So maybe kind of like what we're doing, Denise, with Salvation Army, we're using some money to fund an intern. If we can find some of those little, I don't know, we just feel like it needs jump started again.
I would agree, like Clarity, it's a really great evaluation tool, but some of our partners just don't have the time to be able to plug in some of that information. And Unite Us is another great tool that can help highlight what the gaps and the needs are in our community. But again, just our partners who are the frontline workers don't always have the time to be able to do some of that. And so how can we support and come alongside them to help them get on some of those platforms?
And I just want to check in too, did I hear that you were having conversations around that overall impact being increasing access? Or was there some additional caveats to that?
That was kind of the main one we focused on, Martha. We did look at a few other pieces that I didn't write down what the big strategy was, but the enhancing access was really what I feel like honed in on.
Connecting the dots. So they might be concerned that they don't have a job, but what's really added is they don't have daycare so they can go to work, or they don't have tires for the car, just all those other issues that maybe we can do a better job of removing those barriers.
So let me test the group here a little bit. If we are going to lift up the work of the coalitions and be able to show the work of the coalitions, as well as many other elements of work in our community, into this collaborative by using at least 2 impact statements to begin to bring people to the table, those 2 pieces could be preventing persons from entering the system and increasing access. Are we missing anything? Providing support, okay. Which I think could kind of weave into that increasing access, right? I think. Are we on?
The impact is support.
Right, that they feel the support, right? Are we onto something, and are we missing anything?
I think the impact is also like self-sustainability and sufficiency at some point too.
Looking to see if Joanne is still on our call, but it looks like she dropped off to see if she always has wise words of wisdom when we get to this point. Well, I know we have about 10 minutes left. We'll kick this out to all of you in an email, or at least in the minutes, for you to keep processing. Is there anything else? I think I had a question on the agenda to just ask us one more time as we close here. Let me go back to it if I can. Did we answer the question of how staff and coalitions will be involved in the collaborative? Or did we begin to answer that question?
I think we began.
That was a heavy lift, you guys. We worried about that because there's just a lot of information we threw at you, but we wanted you to know that the staff's working really hard on those pieces, that as volunteers, we're not expecting you to know all of those pieces, but we know that you have a lane that you love and that you're working in, and you're going to continue to advocate for that. And the staff's going to continue to keep looking at that bigger picture of all those working pieces and parts. But we really needed to have this conversation about what are we all kind of trying to figure out to work together. Okay, so we began to answer that question.
And I would say, part of that question is just ensuring representation from those coalitions and staff members, and the work that is happening in some of the conversations that we had within those work groups.
And I think the other thing is finding out where all the organizations, how they fit in to our staff and work groups or coalitions. Where do they fit? And that's maybe not for us to decide. That may be for them to decide. We have to have enough definitions so they understand, oh, that's where I need to be. Because I think that's really important to have this to be a success, is to have them involved. That's the big reach, is how do we impact more? And that's by having more organizations involved in solving the gaps, changing the dynamic.
Totally agree. Michelle has already started a document showing the members of the steering committee, those that have expressed interest in the collaborative, the board, and trying to get all those names in a document so people can easily look and see who's where. And so I think that's a good start, but we're going to have to keep processing that, right? Besides just a list of names, we need to really put some definition and color to that, like you're saying.
And it's an ongoing work. It never ends.
Yeah. I almost see in your model, those intersections, Michelle, in the middle could be the two impact statements that we're talking about. That's what we're holding in the center.
Well, that's part of where the steering committee, I think, really thrives, is how do we mesh those in the middle?
Yeah. Yeah, I'm just processing everything. As always, after one of our really good Zooms, I have to just go process for a while and come back. So thank you. Matt, Matt Lohmeyer, I know you just jumped on towards the end, and we're probably, you may have a lot of questions. I can stay on later too if you have some questions you want to just talk through about the earlier part of this meeting.
That'd be great.
Oh, go ahead.
That would be great. I'll stay on.
All right. I think we got accomplished as much as we could for today. I think we've actually shifted a major mountain here. I really feel proud of the work that we've done today. And I think we're ready to go into the next collaborative meeting, which will be next week, with some definitions and some impact statements for them to begin to test. Let us know if we're on the right track. So good work, guys. Anything else we need to be considering before we wrap up? And then Travis and Nadia, anything else, final comments?
I would just say thank you for your time and brain power working through these things. Appreciate it.
We got a thumbs up from Travis. All right. One other point. Matt and I are going to work together to get some sort of poll out to all of you to find out what is the best time to meet. And we are going to make sure that we tie the names to your answers, because that was one of the challenges we had this time. We weren't sure who said they could come at what time. So we know we lost several people that way too. So we also are going to ask if you prefer the Zoom or if you prefer the in-person meetings, just to give us some idea of what you'd like these meetings to look like moving forward. So we'll get that out to you here fairly soon, along with the minutes. So thank you for your time. Good work today, you guys. Really, really good work. A heavy lift, and you synthesized a lot of information and honed in on some great impact statements. So thank you very much. Have a
Thanks,
fabulous
Sarah.
Wednesday.
Thanks, everyone. Have a good day.
Everybody.